Welcome, everyone. Good morning. My name is Jamie Oyen, and I am the Marketing Director at the Medical Alley Association. I'm so glad that you chose to spend your morning with us today. We have a wonderful discussion coming up on a very interesting and rather timely topic. But first, I wanted to touch on a housekeeping item before we kick things off here. I will be asking our panelists questions throughout the webinar, but if you have questions that you'd like to ask, please use the Q&A function and we'll do our best to either bring them up throughout the conversation, at the Q&A portion at the end of the webinar, or answer them offline if we run out of time. The conversation we're going to have today is covering an important and relevant topic. Many of our businesses have had to learn to exist in a constantly shifting business landscape, thanks to the COVID-19 pandemic. We may not be out of the woods just yet on that front, but there have been a lot of innovations from marketers who have learned from their experiences over the last year and a half and developed strategies to reach, connect, and support their audiences throughout times of rapidly changing needs. Before I introduce our panelists, I want to thank Gamut One for sponsoring today's webinar, and I'd love to give them a few minutes to introduce themselves and their organization. I highly encourage you to check out their work and support the companies that help support your community. Jill, would you like to say a few words?
Thank you, Jamie. Hi, I'm Jill Oldenburg of Gamut One Studios. We are a full-service commercial photography and videography studio in the Twin Cities, made up of 4 partners: Bill Bartlett, Greg Kamen, Jeff Schmieg, and Dewey Koshnina. And we have special expertise in the medical, health, and pharma industries. And for decades, we've been working with large and small companies in these industries to produce all things visual, ranging from a medical device photo on up to larger scale corporate videos that you might want to use in recruiting, for example, or even in some of our post-pandemic still virtual conferences, we need visuals. We've been members of Medical Alley for many years and are very thankful for their tremendous work in this industry, including creating educational opportunities like today's webinar. So thank you very much. It's great to be here.
Wonderful. Thank you, Jill. We really appreciate the support. And with that, I'm going to kick off today's discussion. As I said earlier, if you have any questions, please submit them via the Q&A function. We'll be watching those and we'll do our best to weave them into the conversation. So I want to start by asking each of our panelists to introduce themselves and their organization. I'll go around the virtual room here and I will start with Leah, if you could please introduce yourself.
Yes, hello, good morning, everyone. My name is Leah Noel. I lead marketing for ABM Respiratory Care. The company is kind of a startup company. It started in 2017, and we launched our first product during the COVID pandemic. So it was a very interesting launch, and I'm excited to share what I've learned and things that ways we've adjusted our business practices during COVID.
Wonderful, thank you. Dick, would you like to go next?
You bet. Thank you, Jamie. I'm Dick Schirber. I head up customer experience and strategic planning for a department or division within mHealth Fairview called Shared Clinical Services. Those are all the areas that cover things like lab services, imaging, pharmacy, EMS, durable medical equipment. So not the clinic and hospital area, but those services that are provided across the entire enterprise and out into the community. And very happy to be here.
Great. Thank you, Dick. Last but not least, Jennifer, if you would introduce yourself.
Good morning, everybody, and thank you, Jamie. It's a pleasure to be with all of you today. I'm Jennifer Nardicchio. I'm from Element Materials Technology, and we participate in a wide variety of activities in the marketplace, all the way from aerospace and automotive to connected medical devices, and most relevant for today, the life science and environmental arena, and how we can help make tomorrow safer than today in everything that we do, whether it's for people or for processes, so they feel safe during this unprecedented set of times. So thanks for having me.
Absolutely. Thanks for being with us. All right, Leah, I'm going to start the first question with you, but I will ask all 3 of you to jump in and help us set the stage for the conversation by sharing how you have had to reframe messaging, both internally and externally, during COVID, and then what advice you have for speaking to audiences during nationally or globally sensitive times. So Leah, let's start with you.
Sure. So, being in the respiratory care space and having products that treat people with respiratory conditions, COVID was definitely top of mind in all the messaging that we deliver. We have products that clear the airways, clear mucus up and out of the airways. There's a lot of concern around aerosol. And so when we were working on our messaging, we just needed to ensure that we addressed what our customer concerns were. When we went to launch the product, when you do demos and services, all of that had to be done virtually. Clinics and hospitals were not allowing us to come in during COVID, or due to COVID. So we had to adjust how we conducted our demonstrations. Zoom technology obviously was something we used a lot, but there's also a lot of videos that we created. We partnered with Gamut One to create our video content, and we actually launched it on Modus, which is a great communication app, and that's a way for us to send large video files, and we put them into a microsite so customers can access them at any time, and then we're able to see when they access them. So it was just a great communication tool for us and our sales team going through that. As far as internally communication, everybody working from home was feeling really isolated. We have a global team, so we have people in different countries like India and Singapore, just being aware of what every country is going through, our distributors in Europe, as well as in Asia, keeping the communication line open. So nobody's feeling isolated, everybody's feeling supported as a team. When everybody's remote like this, it's hard to continue that team environment. So having different, times where we can just get together and talk and share what's happening in our countries and what's happening in our jobs, and being there to support each other was really important.
Yeah, that's a great point. Curious, Dick, what has been your experience with messaging throughout COVID?
So we kind of pulled out of the messaging marketplace for a while. We're a provider organization. People didn't want to hear about open enrollment, choosing our clinics. They were hungry for information on how to stay safe, how to stay alive. So it really, it forced us to focus on providing information to our patient customers that they could use to help manage their health. They looked at us as trusted advisors in that. But a lot of the typical kind of health system marketing designed to attract new patients, that sort of thing, we had to pause it. And so the other thing that happened was we spent a lot of time and effort trying to address conflicting messages that were in the marketplace about what to do, where to go. This source said this source said this. Again, under that trusted advisor theme, who's right? What do I do? And so a lot of the messaging was trying to, cut through the conflicting messages in the marketplace, and which I think we did a pretty good job with. The strategy was identifying experts within our system and supporting their capturing of the data, evaluating the data, and then getting them out in front of our customers so that they can deliver those messages on, here's how you want to handle it, and here's how we can help you. It's the sacred trust that our patient customers have in us as a health system to keep them healthy.
Yeah, absolutely. That's a great point. Jennifer, could you share your perspective here as well?
Yes, absolutely. I'll start with external. We already do a wide variety of different types of medical testing both in the product and the health testing services. But what we decided to do is take a look at what's happening around the world and where they specifically or surgically needed more support from a company like us. So we expanded our services to include testing for things like ventilators and masks and disinfectant product effectiveness testing against the COVID virus. So the first was really taking the opportunity to find out where the world needs our help and going after that with our services. The second thing was, how do we do that externally from a really safe and effective way that not only do our internal team members feel comfortable, but our external team members feel comfortable as well. So we instituted a process called what we call internally remote witness. And it allows our clients the opportunity to be able to communicate with us and see their testing that's happening real time inside the facilities without actually having to come into the facility. And then we took it a step further and also partnered with Gamut One, and we took the opportunity to really refine our video capabilities where we can be able to show our clients and our customers what do our facilities look like if you're not comfortable coming in and we really need to make sure everybody's safe at this time period. How can we show you how we can help your business and help your customers feel safe during these time frames? So those are the three external processes that we put into place. And then from an internal standpoint, we really wanted to rally around safety, because while we're, our mantra is all about being safe, fit for purpose and compliant the first time around, we wanted to take the time and say, how could we bring that messaging to life for not only internals, but externals, and weave that into our purpose and values and really focus on keywords and adjectives and messaging that would resonate, that whether you worked for the company or with the company, you knew that we were trying to make tomorrow safer than today. So that's really how we kind of packaged all of those elements together, both internally and externally.
Yeah, thank you. Sounds like, just being very mindful of meeting people where they're at has been top of mind for all three of you. Kind of so, in that same vein, when, you're looking at creating a lot of materials, especially now that we're all virtual, or, we're virtual back then, what, how would you weigh, for example, whether or not to show people in masks or large gatherings of people, or, standing very close together in imagery? How have you handled that? And what advice do you have for marketers, as we kind of move forward throughout, in a post-pandemic world? So Jennifer, I'll start with you on this one, actually.
That's a great question, because while you really want to be able to show, the empathy and the emotion that comes through on your team members' faces as they're working on the products or working through the processes, really right now it's a really big balance. I think the great thing is our team members are already comfortable wearing a lot of PPE, and for the types of services that we already conduct, they are already wearing the gloves and the masks and the gowns. So what we try to do is a balance. If we're in a situation where, team members feel comfortable and we're 6 feet away from a photography or a videography standpoint, then we will see if there's an opportunity to unmask them. If there's something where, say Gamut One or the facility feels like we are too close, we always keep people masked, and we try to do a balance of both depending on the type of arena. But most importantly, if they're supposed to be masked, they're always masked. So we never take the opportunity to unmask somebody if they're doing a test that requires that as part of their daily processes. So at the end of the day, even if they're unmasked, if they're not comfortable, we let them decide what is most important for them, because it really conveys a message of team for us, both internally and externally, that without our team members, those are the most important assets that we have. And we want to make sure that they're protected and our clients are protected every day. So that's how we do it at Element.
That's great. Thank you, Jennifer. Dick, you had mentioned that, making your customers feel safe was a big initiative for your organization. So curious what, how you handled that throughout the pandemic and what you see as kind of best practice moving forward.
So practice what you preach. Okay. So a lot of the limited amount of imagery that we were using, it was, mask on and on topic. And so but again, following that practice what you preach mentality was key. And we also had to convey a lot of, and still have to convey a lot of information designed to cut through the clutter and maybe, kind of push to the side some of the conflicting information that's out there. And so brevity was important, being relevant was important, and cutting through, making our points and engaging our patient customers at that level was key, simply because they were looking at all kinds of sources of information, oftentimes conflicting. Who do I trust? Who do I believe? Where do I go? And all of what we did, whether it was visual, text, digital, traditional, was designed to kind of cut through that clutter and be that resource for our customers.
Yeah, absolutely. Thank you. Switching gears slightly, we had a question come in about, things have been pretty quickly accelerated, throughout the pandemic. So things that may have been in, more long-term strategic plans, 5-10 years even down the road, really were rapidly accelerated. So, we're seeing 5 years of digitization kind of being achieved in the last year and a half. So, wondering what your experience with that has been, and then what you kind of see sticking around. What do you see as being more temporary? Leah, I'll start with you on this one.
Sure. So, being a new company, right? We have a product portfolio that we had our 5-year plan to develop, and we had our strategy of how we were going to get there. But when COVID happened, our team literally stopped what they were doing from a portfolio development standpoint and switched all engineers to developing a pandemic ventilator. And so that just completely changed our product portfolio, really fast tracked that development of the ventilator, our telehealth platform. So things that we had planned, in 3 years, we brought forward in a matter of 6 months and brought it to market. So now we're stepping back and just reevaluating the platform and how we're going to move forward. But it was definitely the right thing to do. Telehealth is here to stay. I mean, it's been rapidly accelerated, as you said, and it's going to continue, even though even when the pandemic isn't as strong as it is right now, people are going to continue to, I think, do remote visits, and that type of platform will be relevant globally.
Yeah, absolutely. Jennifer, how about you? You guys are a global company, so probably used to some form of virtual communication, but what has been your experience through COVID?
So there's 2 things that we've put into place, one internal and one external. And from an external standpoint, I love to partner. You can go by yourself and do an activity or an initiative or a webinar, but partnering with a like-minded company, another publication, another institution, another company that has a really great complement of services for you to go out and do initiatives, webinars, speaking engagements together. Makes you both stronger, and together you're better. So that's one thing that we have been doing, is really trying to find the right partners to elevate our message and to go to market with, whether it's in the Americas or globally. From an internal standpoint, people have not been traveling as much to the trade shows. So there's more time and availability for people to enhance themselves. So one thing I've done for our team, and we're making it widely available to the Element company throughout, is personal and professional growth. Now is the time where, the technology is just leapfrogging itself. And so for our team members to have the time during the day to be able to pick up on a class or learn a new technically advanced way of doing something, whether you're a lab technician or a marketer, it not only makes you better personally for your own self-worth, and it feels like you're growing as a human, but as well, you're helping out the company and the industry with the new intelligence that you've just gained and being able to help take your experience to market. So we're really trying to take our people to the next level, as well as the way we're trying to take our marketing to the go-to-market space.
Absolutely. Thank you, Jennifer. Dick, from the provider perspective, definitely telehealth is a big advancement here, but curious what you think, that looks like long-term, and what you're seeing in terms of, technological adoptions.
Sure. I mean, pretty well documented, COVID really accelerated the utilization of virtual care, virtual appointments. The data that's coming in is showing that it's going to stick around. I think what we're hearing quite clearly from our patients, as well as, and this is nationally, that wasn't so bad. I got it done. And I didn't have to hop in the car. I didn't have to drive there. So we went from, 10 miles an hour to 100 miles an hour in that area in a very, very short amount of time. And with a culture within the organization that was very face-to-face. Okay, we're providers, right? We're in the market, and it was a big shift, and they did a fabulous job of all of a sudden, we have patients and employees in our facilities, and so we can control everything there, digitally, to no one's coming in, now what? And it was just fabulous. My hat's off to the entire IT team and the leadership there and the frontline folks to get that done. It was amazing. I think the other thing that's been accelerated is important to a health system is their EMR, their electronic medical record. We have Epic, which is the market leader. They have a patient portal called MyChart, and we had to figure out quickly how to utilize MyChart to message as well as provide care. And that we're learning more and more, because Epic and its MyChart portal is more of a clinical workflow tool than it is, let's just say it ain't Salesforce, right? And so you have to think a little bit differently about that. And there were internal cultural hurdles to overcome. There's compliance issues as well. But then there's also, I don't know, we've never done it before. And so utilizing that tool to help with the messaging as well as the care, I think is going to be important. I think the other thing that we're still working with is that we've noticed that consumers during this pandemic, consumers were kind of forced to think about what care is essential and what isn't. And they were making choices there. And some of them we agreed with as providers, some of them we didn't, but doesn't make any difference. That's where they're headed. And so I think long-term, that's the thing that we're going to have to start addressing even more is we know what's important for better health, but patients need to be engaged. They've got a different perspective. Things got turned upside down the last 18 months. And so, you know, coming together on that with our consumers to reach better health outcomes is a big, you know, long-term thing that we have to wrestle with and figure out.
Absolutely. And, you know, we got a question in, and this kind of ties back to, you know, your first answer talking about how you had to prioritize cutting through the clutter and the noise that, you know, your customers were experiencing. But, you know, if you could share any tactics that you and Fairview Health Services kind of employed during that time. I mean, it might be the MyChart utilization or other things. You know, the audience is curious, Dick.
We stopped killing a lot of trees and went digital. I mean, it's really, it couldn't be any simpler than that. We just, in terms of a venue to make contact with and continue the dialogue with our patient customers, we had to go digital. So, you know, sending, you know, itinerary or confirmation letters in the mail, you know, why do that? Why not connect with them? Oh, gee, surprisingly low percentage of our patients utilize MyChart or give us permission to use their email or their cell phone to message them. So we had to think differently about that, and we found them very receptive to that. One of the services that we have that's actually national is our specialty pharmacy. We take care of almost 11,000 chronically ill patients that are receiving high expense self-injected medications across the US. We have them in all 50 states. So they were used to a remote model, but by phone. And we quickly had to implement, digital two-way texting with our team in order to cut through the clutter that and get right to their phone, because that's where everyone was communicating. So it's really accelerated the use of digital platforms and being brief and being relevant, because we're communicating very important things that are keeping patients and their family members alive. So let's zero in.
Yeah, absolutely. Thank you, Dick. So when we've looked at marketing, digital marketing has always been a component of a marketing strategy for a company, but now it seems to be the, critical piece of a marketing strategy, and curious what your thoughts are on, how digital marketing and its increased role will affect traditional marketing approaches that maybe your company had in the past. And I'll start with you, Leah, on this.
Sure. So similar to what Dick said, we're stopping our tree killing. We're really cutting back, obviously, on paper. Like we using the Modus app, like I had said, and that app for our sales team allows them to share every piece of content that we have digitally and email it right to the customer, and then they can refer back to it at any time. We're looking at other ways to share information as well. Podcasts are a great way to share information, sound bites. A 10-minute podcast can get a lot of relevant information to somebody in a different format than having to take time to read. in a study that was conducted by Microsoft is just top of mind right now. So Microsoft has found that the human attention span has declined from 12 seconds in 2000 to 8 seconds in 2021. And when you think of like, they referenced a goldfish who has a 9-second attention span. So the human attention span is very short. So having relevant information that can be quickly digested is really important. And so we're keeping that in mind as we're developing content with all of our products.
Yeah, that's very interesting, Leah. Thank you. Jennifer, curious what you think on this.
Yep, I'm just going to ladder on what Leah was saying with the relevance of the digital content. Like paper is over, and we really need to figure out what is the right visual that we can get to our customers in a digital manner, so that when they see it, it is, you know, to Dick's point, it's a brief communication, it's relevant, and it hits the exact communication points that customer or prospect is looking for. Because it's really hard if you're not face to face to maybe understand through the facial emotions or the additional adjectives that you might be able to add to a live conversation. So bringing to life virtual events or bringing to life digital collateral is going to be really what we're working on over the course of the next 6 to 12 months. Because if you can convey your message with the same level of empathy and you know, message delivery that you can do one-on-one, I think you really achieved a lot. So we're all learning through the virtual events arena, because they're all different on the types of scale of what they allow you to do and what you can do based on the different platforms that are out there. But I think just having worked with Jill and the Gamut One team, we're really trying to take our video to the next level and make sure that it is showcasing everything that we can do in that, you know, 30 to 60 second bite-sized frame. And then from a collateral standpoint, really making sure that everything is hot linked. Don't just put words on a page. Make sure that you can actually link that material back to that thought leadership piece of material that your expert is talking about, or maybe you can link it back to a video that you've just created, because sometimes a picture or video has 1,000 words to it. So really trying to take that virtual level up a notch for 22. That's what we're trying to do.
Yeah, absolutely. Another question we got in kind of related is, you know, what sort of efforts or tactics are you using to measure the information that you're pushing out to customers? So, you know, with it all being so digital, is there, you know, new strategies you've implemented to ensure that you're not only creating the right content for the audience you do have, but, you know, kind of measuring its performance and things like that, and ensuring that you're really hitting the right point with the right audience at the right time. So Jennifer, I'll actually go back to you on this one first.
Sure. So to me, impressions are really important and registrations are really important, but it's not as important as the number of people who actually stay through and maybe ask you a question or follow up on your piece and click through it to get a little bit more information, or maybe fill out that form that says, I might not be ready to invest yet, but I'd like a little bit more information. So we really try to take our metrics to the next level to see and gauge the interest that people have in the different materials that we're putting out there. And that really helps us judge whether or not we should be doing similar type of activities in the future, maybe changing them up a little bit because a little bit of this is working, but a lot of this is working. So balancing the effect out a little bit. And maybe there's some things that just don't work really well, or we haven't mastered it, and then really trying to change that up or look to the experts who maybe have mastered it in the marketplace for a little assistance so that we can follow suit someday too. So that's how we're doing it at Element.
Great. Thank you, Jennifer. Dick, curious if you guys, you know, are with telehealth being kind of a newer frontier, is that something that you guys had, you know, metric tracking in place, or has that been, you know, you need to figure out new strategies around that?
Well, from a digital perspective, the venue, the highway that it has allows for very easy measurement, much more so than traditional marketing. And so it's something that we've been doing. We have now more trucks and cars running down that highway, so we've got more to measure. I think the thing that we had to start looking at differently is how we tie that increase in activity from a marketing perspective into the results that we see in our clinics and hospitals, the volume of activity, or the call center, the volumes of activity there, or quite frankly, a decrease in volumes of activity to the call center because we've been able to deliver relevant marketing message to customers so they don't feel like they have to, pick up the phone and talk to us. They get what they need digitally. And so it's that bridge between the marketing driven activities into the activities that we actually, the outcomes, the things that we want to see happening in our shared clinical services and in our clinics and the hospitals. And we're working on it. We don't have it nailed. I think, as I mentioned earlier, the electronic medical record is basically a massive clinical workflow tool. And now we're starting to ask it to say, what are the outcomes from our marketing efforts and tying that together? It's a big chore, but we're on it, because that, I think, is the ultimate measurement. That's the why we did what we did. Let's see if we had the intended outcome.
Yeah, that's a great point, Dick. I want to switch gears a little bit. And, when we look at across industries, not just healthcare, labor shortages are, oh, yes, sorry, Jennifer.
I just wanted to jump on a really important point that Dick had mentioned relative to the call centers. Our call center is one of the most important avenues we have here at Element. And he mentioned something really important in the fact that results can come in the form of quantity of calls. And I wanted to ladder on the fact that we have learned through some of our pieces that we can judge our messaging based on the types of conversations that come into the call center off of our pieces. So if we hit the mark on the piece, people will call in asking for the exact service or process or support that we're looking to provide them. If we're a little off in that messaging, and it goes right back to, being brief, being relevant and to the point, if we're a little bit off on that, we could see a spike in calls, but they might be calls for something completely different. And every now and then you'll get a chuckle as to some calls that are coming in, and they'll give you a notification that maybe your message was a little bit off on what you were trying to portray in your marketing piece. So I love using our call center as really a gateway to tell us, are we on point or not with the message? And that allows us, if we are on point, to elevate it and push it out further. And if not, pull it back, modify it, and relaunch it for another A/B comparison to see if it's hitting the mark. So call center is definitely, if teams out there have them, if you can partner up with them, I try to meet with ours on a very frequent basis, just to make sure that we are in lockstep with their team.
Yeah, no, that's a fantastic point, Jennifer. So, with labor shortages being experienced in all industries, I'm curious what your thoughts are, on what this effect this is having on the role of the marketer in an organization. Leah, I'll start with you.
So, I guess I've had a lot of people reaching out to me. There's a lot of openings, I know, for marketing. And I think that that's just going to continue across all the different functions in an organization. I know we're hiring a lot of engineers and supply chain. So I think there's just a shortage across the board, but I've noticed that in marketing as well.
Yeah, absolutely. Dick, what do you think here?
Yeah, absolutely. Marketers are in short supply. it's just the fact of the matter. And like a lot of positions are in short supply, especially in healthcare, tragically so. But yeah, they're in short supply. We've got to compete with to attract and retain from a smaller pool. Maybe temporary, maybe not, doesn't make any difference. We got to get it done. I think the other thing related to this is that, and this is kind of a well, some people will consider it a no-brainer, but I'm continuously amazed at the fact that because of social media, all of your employees have become marketers, and tapping into that and understanding that, encouraging and helping that to craft your message, I think is key. I don't think that controlling it is the solution, but facilitating it, setting expectations, helping with the messaging. Is it going to offset the fact that we can't, hire full-time marketers? No, of course not. But especially in an organization like ours, where we're 32,000 employees and they all live in the community here. Man, that's a resource that we need to continue to leverage and support from a marketing perspective.
Yeah, no, thank you for your input, Dick. Kind of related to that, Jennifer, you had mentioned that you are investing in your employees and their professional endeavors, and do you find that helps them champion your organization, both internally and externally when you're looking to recruit or kind of tell the story of Element?
Absolutely. I really look at Element's marketing team as a center of excellence. And it's not just about the work that's put out, but it's about the people. And we just try to make sure that they have the opportunity to accelerate their knowledge base by taking the appropriate training to keep relevant with what's happening in the marketplace. So first and foremost, personal training and empowerment for the internal employee, especially on my team, as well as all of the other teams across Element. That kind of leads to what Dick was saying about loyalty. We really try to even put out newsletters quarterly to let our team members around the Americas know what's happening within all of the different verticals that we're doing. So people have an understanding if they're at a holiday party or a friend's house or a birthday or a kid gathering, that they can take the messages of what Element is all about and the things that we're trying to do in the marketplace to help make it, safer today than it's ever been because of the situation we're in. They can take those key messages with them through the mechanisms that we share out on a regular basis. And then just with regards to the shortage, there is a shortage everywhere. But if we can make ourselves a center of excellence and then bring in, what we've done this year is student interns. And it's worked out really well. Not really young ones where they're maybe just their first year or second year, but more their third or fourth year. And they've specialized and, they're in either a digital capacity or an events capacity or a PR capacity. So we know where their strengths are. If we have an opening there, then we can bring them on and groom them, knowing full well they can pick up a couple key tasks that might be taxing for our team to get done right now. And therefore, we can leverage them. And at the same time, they can leverage us and learn about what the marketplace is right now and how their career might unfold. So those are the couple of things that we've been doing, and they seem to work out pretty well.
Yeah, I think those are all great points, Jennifer. When we've talked a lot today about, how we've all adapted to COVID, virtual, digital, things like that. I'm wondering, what you guys see as if it will ever go back to, business as normal, or what the new normal for your business might look like. And then what happens to all of the investments that you've made thus far in those, virtual digital tools and collateral or things like that, what happens to that moving forward if you have a plan? Leah, I'll start with you.
Sure. So since we are a startup company, we haven't invested in a large office. So being remote is working out for us, and our small offices when we are together for team building when it's appropriate has worked out well, and will continue to do that in the foreseeable future. Our product platform and the remote monitoring platform that we are building will continue to evolve, as telehealth evolves and people being followed remotely and being able to adjust medical devices in the home remotely, and keeping that communication open between the healthcare provider and the patient is going to be really important in our product development. So those are things that we have already built a baseline for this year, and we're going to continue to evolve it in our products moving forward.
Yeah, thank you, Leah. Dick, what do you see for Fairview and your team?
So we were on the digital highway. We just tromped down on the accelerator, and all the assets that we've created during COVID, all apply and need to be fostered. One of the examples I use to illustrate this point is one of our customers for marketing and outreach, which is what healthcare calls selling, is connecting with referring providers. And traditionally, you do that detailing, right? You show up, you've got an appointment, you show up, you talk, you get out. And a lot of the audience is well aware of this and probably does that for a living. Guess what? Couldn't do that for a while. And I think what we found recently, now that we've started back into approaching providers, is, what? Let's do it over Zoom. You don't have to be in the audience. So then we had to start rethinking about how we present and what we present and how we deliver the information to them as a resource. And a lot less trees, more bits and bytes, and even little things like, well, where are we going to store this so I can reference it later? Hadn't thought about that. So we had to quick work with the clinics as to, okay, well, do you have a shared folder? Maybe you can keep this, and so it changed a lot of how we had to deliver information and keep it relevant. And I think it's all good because it's faster. It reduces cost, which is important in healthcare as a provider, and keeps it relevant. It's digital. You can update it. Next time they log in, it's, oh, that's different. Oh, they added a new service, and it's just there, as opposed to, loading up in the car and driving, showing up and re-explaining it again. I hope all of our outreach people are able to make the transition, because it is, it's not going back. There's data that shows it's not going back to the traditional model. And in order to be competitive, you got to be good at that sort of outreach for that particular type of customer base.
Yeah, no, those are excellent points, Dick. Jennifer, do you and Element, do you think that there is a hybrid situation in your future, or what are you seeing on that front?
I really do. And I'm a people person. I so hope that we get back to the point where we're able to engage, at events on a more frequent basis, build relationships. At Element, we're all about relationships, because if you can be on that one-to-one level for somebody, and they know that you and they are going to be there together through the thick of it and get it done on time with certainty, that's really everything that is what we're all about. So I think the toolbox is a really big deal. I don't think that we will eliminate anything from the toolbox. I think it's more so, how do we take what we've had to use in the past and bring it up to the new virtual level? And then how do we learn about how we can maximize the new opportunities out there for, machine learning and AI and virtual reality? And how do we utilize these new tools and techniques that are out there with our data scientists and bring those to life in a marketing or even in a technical arena to expand our toolbox with our customers. Again, going back to what Dick was saying, it's so critical to be on message, to be short, sweet, and to the point, and at the right time and at the right place where that customer wants to take in your message. Because if you're at the wrong place at the wrong time, obviously it's just a message and it'll never be received. So really taking that toolbox to the next level. And I think what's really exciting for us is, we are one of the largest 5G testing and certification companies. And it's really important, you don't think about it every day, but it really plays into the aerospace arena, in the connected medical arena, and in the autonomous arena, to just make sure that we always bring our digital life into our vehicles and our products and bring that back into our digital life, so that we're sharing one-on-one with everything that this new technology is bringing our way, and just learning every day, being sponges to absorb how we go to market in a new way without losing all the stuff that we've learned along the way. So that's what we will be doing. And I surely hope that we'll have events back in our future so that we can start meeting and greeting with people live on the scene.
Yes, as do we. Thank you. I really appreciate your insights there, Jennifer. And, we're running up on time. So I wanted to say a huge thank you to all three of the panelists here for sharing your insights and advice. And a very big thank you to our attendees for joining us today. I hope you learned a few new things and you walk away feeling more empowered to help your organizations thrive. I also want to say thank you to our sponsor, Gamut One, for helping to make this webinar possible. And I hope you all have a wonderful day. Thank you, everyone.